Temperature. Temperature, up and down, doesn't only mean you have an infection. It could be for more than one reason. But if a kid has 103, 104, I always try to get the kid's temperature so he's comfortable below 102. And I tell parents, if it's below 102 and the kid is laughing and playing, leave it alone. There's no side effect to any drug you don't use. Is that true?
That's right. And over-medication, has its risks. There's no... Physiologically, it makes no sense to try to beat a temperature down to baseline.
And a little temperature makes the immune system work a little bit better. Is that true?
What the fever is telling you is that the body is actively participating in
something.
Right. It's
could be infection.
Reaction. Right.
But it doesn't always have to be. It could be overdressing. You can have heat problems. So fever is not a bad thing. It actually is a good thing. It's the immune system doing its job. And also, a misconception, my kid is very sick, has 104. Whatever I did, aspirin, Tylenol, Motrin, whatever I did, Tylenol, I brought it down to normal. My kid's okay. Right. That isn't true. You could have meningitis in the hospital and bring it down. The kid still has meningitis.
That's right. So that's what you're referring to as a false sense of security by being able to, again, flatten the fever curve temporarily. And I just don't think there's any rationale for using alternating acetaminophen and ibuprofen.
Oh, I agree. Oh, I found a person agree. In fact, there was an Israeli study that said that Motrin, Advil products, actually decrease the white count in some patients, and white blood cells are your soldiers to fight the infection.
That's right.
So maybe that isn't such a good idea. And Tylenol, which is safer in some situations, older kids, sometimes liver problems, it's not 100% free ride. It seems to be a little bit safer. So here's the rule. The kid's okay, under 102, playful, leave the kid alone.
That's right.
And if the kid is uncomfortable and you want to make the kid comfortable, I'm not against giving a little Tylenol in that situation.
That's right.
Also, if you get a high fever, alcohol baths are out.
Absolutely.
And there was a reason, I think it was in Ohio, they found a kid actually had toxic levels of alcohol, and they started realizing it gets absorbed to the skin.
Correct. Yeah.
And also, if you bring a fever down slowly with a tepid bath that's high, with a little Tylenol, and the kid's more comfortable, it's more apt to stay down. Is that true?
That's right. Otherwise, you do risk the rebound. Because after all, again, the body's doing what it has to do in mounting this inflammatory response, and the fever will rebound.
Could you say Mother Nature's smarter than any doctor? It does it for a good reason?
We shouldn't try to improve on nature, right?
So Mother Nature does it, and you don't argue with your mother, is that correct?
That's right.
Your mother was always right.
Always right, yeah.
Okay, remember her birthday, and remember Mother Nature when she does the fever.
That's right.
So in other words, leave it alone if the kid's comfortable at 102.
And
that makes sense?
Rule. That absolutely makes sense. I have another rule. When you have chicken pox, you don't use ibuprofen. And that's because actually a study showed, similar to the Israeli study, that ibuprofen actually suppressed the inflammatory response to the point where signs of inflammation of secondary infection, again, the cellulitis due to the flesh-eating group A strep, was actually masked. And the cellulitis and fasciitis wasn't recognized until much later.
Can't believe a person agrees with me. My whole family doesn't agree because I don't know if you know, I'm a Red Sox fan living in New York. I have a problem. But I found a person least agrees.
You're like my son.
Oh, a breath of fresh air. So in other words, fever is not a disease.
Right.
It could be an indicator of an infection. Not always. You should find out why the kid has a fever in the first place and address those issues. Make the kid comfortable. Try to get it below 102. And if the kid's comfortable, you leave it alone. If the kid has a headache and uncomfortable, little Tylenol, make the kid full. But remember, if that kid isn't playful, and the fever is comfortably brought down to 102 or less, and that kid's very lethargic and has photophobia, that's a red flag that something more serious going on. Is that true?
That's correct. And that's where pediatricians are trained to call that a toxic appearance and suspect.
And do the appropriate measures or whatever it is.
Infections, right?